do we typically wait for the council rep to join us?
Nope, we can proceed.
Okay, great. So it is 1:01 and I will call the meeting to order. We will begin with roll call. Adriana, would you please get us going on that?
Absolutely. Kevin Bond. Tyler Denham.
Present.
Kevin Doby. Karen Flores.
Here.
Sandy Flores.
I'm here.
Jackie Kellogg.
Here.
Devonna McLaughlin. Sarah Meyer.
Here.
Moses Milazzo.
Here.
Sarah Miles.
Here.
Corey Runge.
Here.
Jen Vargas.
Present.
Haley Zaroya.
Here.
Thank you.
Great, thank you, Adriana. So the next order of business is the land acknowledgement. Could I get a volunteer from the board commission to read the land acknowledgement?
I can read it.
Go ahead.
Thank you, Sarah.
Yeah, no problem. The Housing Commission humbly acknowledges the ancestral homelands of this area's indigenous nations and original stewards. These lands, still inhabited by native descendants, border mountains sacred to indigenous peoples. We honor them, their legacies, their traditions, and their continued contributions. We celebrate their past, present, and future generations who will forever know this place is home.
Thank you so much, Sarah. Next, we have public comment. At this time, any member of the public may address the commission on any subject within their jurisdiction that is not scheduled before the commission on this day. Due to open meeting laws, the commission may not discuss or act on items presented during this portion of the agenda. To address the commission on an item that is on the agenda, please wait for the chair to call for public comment at the time the item is heard. Adriana, do we have any members of the public here today or any emails from members of the public?
I'm not seeing anybody.
Okay, thank you. I did not see any either. Item number 5 is approval of the minutes. Do we have a motion to approve the minutes from last meeting?
This is Commissioner. Sorry, go ahead. Who was it?
Sorry, it's Karen.
Go ahead, Karen.
I'll move to approve the minutes from last month's meeting.
Thank you, Karen.
And this is Commissioner Zaroya. I'll second it then.
Thank you. So we have a motion and a second. Do we have any discussion of the minutes? Okay. All those in favor of the motion, please signify by saying aye.
Aye.
Any opposed, please signify by saying nay. And do we have any abstentions? Okay, great. This month we have no action items, so we will move on to item number 7, presentation and discussion items. To start, we would like to welcome Sarah Meyer to the commission. Sarah was appointed to fill a building and real estate professional seat. And Adriana, would you like to take over?
Thank you, Chair. Sarah Meyer, thank you for joining our commission and for applying. At this time, we would love for you to tell us a little bit about yourselves. And then I did give the whole Housing Commission a heads up. Maybe that's why some of them didn't come today. That they would be providing introductions too, since we have 3 total new commissioners as of last month. So Sarah, will you get us started on that?
Hi, everyone. Glad to be here and a part of this commission. I am a realtor here in Flagstaff, born and raised, and something unique, I guess, or my favorite kind of thing to do is be at the lake. So if I'm not working, then we are at Lake Powell. That's kind of our second home. Otherwise, we are here. I have 2 kids, 8 and 9. They are at D. Miguel Elementary here in town. I also serve on the PTO there. I'm also involved in launching the National Association of Home Builders back into Flagstaff. It hasn't been here for about 15 years. And we have just learned that it is a need amongst the builders and local trades, not only to encourage younger generations to get involved and work in the trades because there is a shortage, but just to have some quality control and a sense of community amongst the builders, and also new, home buyers that are wanting to build, and just have some collaboration with the city and the realtors and the builders. So I'm excited to be involved here and get that program going as well. So thank you for having me, and thanks for being so welcoming.
Thank you so much, Sarah.
Shall I start calling on people?
Yes, Adriana, would you mind?
Absolutely.
Thank you.
We will go down the list. So Corey, would you please go next?
Hi, everybody. My name is Corey Runge. I'm the Director of Livable Communities at the NARBA Institute. And under that, I run some programs for permanent supportive housing with people with serious mental illness throughout Northern Arizona in 5 different locations. I also privately own a couple of short-term rentals and a couple of long-term rentals, which keeps my interest in the housing realm. I like to go hiking and camping on my weekends when I get a chance, and spend a lot of time traveling and with my family in my personal time.
Thank you, Corey. Devonna, I have you on the list next.
Sorry, I was trying to find the darn buttons. Hi, I'm Devonna McLaughlin with Housing Solutions of Northern Arizona. I don't know what else I'm supposed to say, Adriana. I'm sorry I got in late.
You're supposed to sing your high school song.
Yep, I don't know what that was, but our high school
I'm just
mascot was an acorn, so I don't think it would be a great.
Devonna, fun fact, please.
Yeah. I have no fun facts. I can't think of a single fun fact.
Vonda's the Director of Housing Solutions of Northern Arizona.
Yeah. And I travel mostly for hockey games for my kids. That's probably my life at the moment. So thanks for having me on.
Thank you, Devonna. A good team player. Sandy, would you go next, please?
Sure. Hi, everybody. I'm Sandy Flores. I'm the Senior Director for Catholic Charities in Northern Arizona. I've been with Catholic Charities. I started in the housing program and now oversee both housing and homeless services and child welfare. Fun fact, I love roller coasters, but I am deathly afraid of the Ferris wheel. Take me upside down, but just don't leave me in that open cage with no seatbelt.
Sandy wins for the fun fact. Haley, your turn.
Yay. Hi, everyone. I'm Haley. I work for a commercial real estate developer and redeveloper based out of California. However, we do have a couple of properties here. And I've been in that industry for the past 17 years, doing mostly retail shopping centers, but we've recently branched out into multifamily, which I'm really excited about. That's the boring stuff. A fun fact, I guess, I'm super passionate about the outdoors. I have hiked the Grand Canyon 7 times, and that's it.
Thank you, Haley. Jackie?
Okay, so I'm Jackie Kellogg. I'm the broker at West USA Realty. I've been on the commission, and this is my second term, I believe. And That's it.
Sounds good. Thanks, Jackie. Jen, would you go next?
Hi, Jen Vargas, Development Director at Habitat for Humanity. This is my second commission meeting, so again, thanks for having me. And fun fact about myself, my life pretty much revolves around my ancient dog, who is slowly but surely leaving us soon, but not on my watch right now. But yeah, that's it.
Thank you. Karen? All right, let's come back to
Here,
Karen.
I'm sorry.
You're
I
totally
couldn't
fine.
I couldn't find my mouse. So, okay. Karen Flores, I am a local realtor here. A realtor. I'm not a realtor. I'm a lender. I talk to realtors all day long, so that's why I think I'm a realtor. I don't know why my screen is all fuzzy. But as far as the commission, I have been on the commission since it started with a few others that are on the commission still, and enjoy being on it. A fun fact is I am finally free of children in my household. So that's all I have.
Thanks, Karen. And we have our council liaison today. Council liaison Kara House, would you like to introduce yourself today?
Sorry,
The
I lost the
buttons today,
meeting on my
man.
screen. Thank you all for being here. My name is Kara House. I am your council liaison. I also was a member of the Housing Commission from its inception. I think from the beginning, I served as vice chair and then briefly as chair before my appointment to Flagstaff City Council. So I love this commission. I am so deeply grateful for all of your work and your dedication to serving our community in this way, and hope that I can be as supportive of all of you in your role as commissioners as I can be. So if there are questions that you ever have or support that you feel you need as commissioners, please don't hesitate to reach out to me and let me be as supportive of you as I can.
Thank you, Councilmember House. Sarah Miles. We have two Sarah M's, so please don't use Sarah
I know.
M.
I was thinking that too, and they sound kind of similar. Myers, Miles. My name's Sarah Miles. I am also a new commission member in the low income housing expert role. In my working life, I am a case manager at the county's health department, Coconino County Health and Human Services, and I work on the front lines with clients navigating all the low income housing stuff and barriers in Flagstaff and the county. And a fun fact about me is when I'm able to, I like to travel internationally, and in August I went to Sweden and Norway. It was beautiful.
So cool. Thank you, Sarah. Mr. Chair Milazzo, would you enlighten us?
Sure. Thank you, Adriana. I'm Moses Milazzo. I've been on the commission since the beginning. This is my first stint as chair. I am also the liaison between the Housing Commission and the Board of Directors for the City of Flagstaff's Housing Authority, which manages the HUD and other federal funding for housing. I am also on the board of the Housing Solutions of Northern Arizona, and I'm on the board of the Flagstaff Shelter Services. So if it's not clear, housing matters to me quite a bit. My professional life, I am a NASA contractor and do a various number different kinds of work for NASA and associated institutions. Fun fact about me, I love to hike. I mean, pretty much, I think that's given. If you live in Flagstaff, you love being in nature. So that's me. Thank you.
Thank you, Moses Milazzo, who has nothing interesting to say today. NASA, no biggie, right? All right, Sarah Meyer.
We kicked
Sarah,
this off with Sarah.
I started with you. Thank you. Let's move on to Mr. Tyler Denham, and that'll be our last commissioner. And then staff, if you want to provide just a quick hi, this is whatever your name is, and then your title would be awesome. Make it quick and easy.
Yeah, my full name is Tyler Denham. I serve on the commission as a community representative. In my professional life, I work as the executive director of Flagstaff for affordable housing. And a fun fact about me, I'm pretty sure this is the same one I recycled from the last time we did this, but I speak Brazilian Portuguese alphabet with a very thick accent.
Thank you, Tyler. Staff, I'll go first. I'll lead the group. Adriana Fisher. I am the housing program manager here at the housing office. And I'm also your housing commission liaison if you haven't already figured that one out. I'm sure it'll come. Who wants to go next?
I'll go next. Hi, everyone. Justina Costa. I'm the Assistant Housing Director and have the privilege of working with this phenomenal team that you're about to meet.
I can go next. I'm Aiden Rutledge, and I'm an administrative specialist currently part-time with the housing section.
I'll hop in. My name's Christine Pavlik. I'm the Housing and Grants Administrator, primarily administering federal grant dollars, including the Community Development Block Grant, which you will all hear a lot about today.
I'll jump in really quick. This is Jennifer Michelson. I'm the Housing Planning Manager. I work a lot with development and planning, trying to get new affordable units online here in the city. And I'm going to take this opportunity to introduce our new housing planner, Sullivan Moore. We just hired him less than a month ago. So I'll let him say a little bit. We're really excited to have him. Go ahead.
Hi, folks. Sullivan Moore. Like Jen said, I'm the new housing planner here. Yeah, I'm excited to be here. Still figuring out exactly what I do.
Right. I'm Marissa Malloy. I'm a housing specialist with the housing team. I work a lot with Christine with our CDBG programs. I manage our down payment assistance loans, and I do a lot of admin stuff for the team.
I think we got everybody. So I'm going to hand it back to you, Chair Milazzo.
Thank you, Adriana. Thanks, everybody, for introducing yourselves. I think this is one of the most fun moments that we get to have about once a year or so when people introduce themselves and we get new people to join. Next, we're going to move to 7B, which is a presentation and request for input on the 2026 to 2030 Community Development Block Grant, CDBG, Consolidated Plan. And Grace Orr will be presenting and requesting input.
Thanks so much. I'm just going to introduce Grace really quick. So just to kind of give some background, every 5 years, the city works on our 5-year consolidated strategic plan for CDBG, and we contract with a consultant. And so Grace works with our consultant, and she's going to be providing this presentation for us today. And she's also going to be taking your input and leading the discussion. I'm here to answer questions, but just so you know, we are really excited to have them on board to help us make this plan something awesome. So thanks so much for being here with us today, Grace.
Thank you,
Christine. And good afternoon to everybody. Like Christine said, my name is Grace Orr, and I work with the consulting company Civitas. We are a HUD technical assistance consulting firm. We work with grantees all across the country, primarily with CDBG and home funding. And then we also do a lot of these con plans. So I think in 2025, we did over 60 con plans. So we stay busy with this work. I am located in Charleston, South Carolina. Love the beach, but it's very flat, so I enjoy traveling to Arizona. Last month, actually, we had a conference in Phoenix. And at the end of the week, the team took a trip up to Flagstaff and we spent a couple days up there for a team retreat. And we had a lot of fun, great city. And Eric, our principal, will actually be coming back out next week to do some more focus groups related to the con plan and some public meetings. Unfortunately, I will not be able to be going that time, but hopefully you can get a chance to meet Eric, and I hope I can come back one day soon. So for this presentation today, I'll just kind of give some background information on CDBG and the con plan and that process, go over some of the preliminary data that we have collected so far, and then open up the floor to get your feedback on priority needs and goals that the city should focus on with the CDBG funds over the next 5 years. So just quickly going over some of the basics with CDBG. I know we have some new people on the call today that may not be familiar. So the CDBG grant is a program that's created to primarily support low-income residents in the city. So that qualifying criteria is based on the area median income. So residents that are 80% AMI or below qualify for CDBG programming. And then just the high level goal of the CDBG program is to create suitable living environments, affordable housing, and economic opportunities. So within these kind of 3 pillars, we have 6 categories of eligible activities. So the first one is public improvements. Those types of activities would be like your sidewalks, roads, water and sewer improvements, so more infrastructure focused. And with those types of activities, those are benefiting a specific neighborhood or area. So with these types of activities, those funds would go into low-income neighborhoods. All of that information is based off of census tract and block groups. And then we also have public facilities. So that would also include like your city parks or community centers in low-income neighborhoods. But this also includes homeless shelters. I know the city has put a lot of money towards hotel conversions into homeless shelters. So that's a qualifying activity under this category. It can also assist other types of nonprofits, senior centers, food pantries, things like that. But these 2 activities are focused on construction. So like with the public facilities going towards nonprofits, all of that is construction work. And it can be rehab work, but we have rehabilitation as its own category because CDBG can also be used for housing rehabilitation. So that can go for owner-occupied rehabilitation, and this program has a lot of flexibility in that program design. So they don't have a lot of requirements on what the program has to look like. So a city could do something simple, just specifically like roof replacement, HVAC replacement, or it can go as far as reconstruction. So there's a lot of flexibility there. And then we can also rehabilitate rental housing, affordable rental units, and that includes public housing as well. And then we can also put money towards economic development. So with that, there's various different types of activities under economic development, but job training and workforce development, technical assistance to businesses, assistance to micro enterprises. We also see a lot of commercial facade and facade improvements under the economic development category. And then we also have acquisition. Acquisition can be used for various things. So that can be, public land that the city wants to convert maybe to a park or something. It can be acquisition of a public facility to help a nonprofit get started. This also includes housing. I know for the last few years, the city has put some money towards rental unit acquisition. And then finally, we have public services. So a lot of times this money goes to nonprofits. So your supportive services like case management type programs, food pantries, homeless shelter operations. So you have public facilities, that would be construction, and then public services is the actual operating. One thing to note with public services is HUD has capped the amount that we can spend on public services to 15% of the annual grant. So we do have a limitation on what we can spend for public services. One big thing that you do not see on this list is new construction of housing. So although a big focus with this program is affordable housing, new construction of housing is not allowable under the CDBG program. However, I gave a couple of examples, and there are other ways to address affordable housing with these other activity types. One example that we see a lot with like Habitat for Humanity, for example, a city or county will take some money for infrastructure and help do the initial infrastructure for a neighborhood, and then Habitat will do all of the vertical development. Now moving into an overview of the con plan. So Christine said,
I'm sorry, Grace.
this is...
Grace, could I interrupt real quick? We have a question, I believe, about the previous slide.
Oh,
Go
I'm
ahead,
sorry, I
Devonna.
didn't see that.
Commissioner McLaughlin.
Yeah, thank you. I'm sorry to interrupt, but you just said that CDBG funds cannot be used for construction of affordable housing. It's my understanding that if you have a CHODO, that a community housing development organization can be funded for construction of affordable housing.
Yes, thank you for clarifying. They're only that specific type. With CDBG, they call them, I think it's CBDO, but a specific type of nonprofit organization that focuses on housing can do new construction, but in general, new construction is not allowable.
Okay, thank you for that clarification.
So the overview of the con plan, like Christine said, it's submitted every 5 years. So once the city reaches 50,000 population, that threshold, a city will be eligible to receive an annual allocation of CDBG funds. And this is a formula allocation that HUD figures out every year. So it's not really a grant application. The city is entitled to these funds, but in using these funds, we have to tell HUD what we're going to do with them. So there is the 5-year consolidated plan, and then each year there is an annual action plan. So the 5 major pieces of the con plan, first we have the needs assessment. That's just a data analysis on population, income, housing problems, housing cost burdens, special needs like needs for seniors, homeless, things like that. And then we have the housing market analysis. So that's more on your housing stock, your housing type, sizes of housing, age, things like that. And then we also look at some economic factors. So we analyze various business sectors and kind of compare the amount of jobs available versus the amount of people qualified to work those jobs and see if there's a mismatch anywhere, education, things like that. So the needs assessment and the market analysis are really the data heavy pieces. And once we develop those help inform the 5-year strategic plan. So in the 5-year strategic plan, the city will identify priority needs and goals that the city will address with CDBG funds over the next 5 years. So when we do this 5-year con plan, we pick a few things that we're going to focus on. And although there may be all of these eligible activities that I just listed, the city kind of has to stay in this scope of the strategic plan and what you decide to focus on for the next 5 years. And then after the strategic plan, we have the annual action plan. So this year it'll be the 2026 annual action plan. It'll be included in the consolidated plan. But then in 2027, we'll have another annual action plan. And so it's just a smaller component that each year has to tie back to your strategic plan. So once we get our allocation, we just tell HUD, this is what we're going to do with the funds to address this need and this goal. And then another big piece of this process is citizen participation. And I'll go into that a little bit more on the next slide. But through this whole process, we want to get community input, stakeholder input, and then help those inform our decisions as we help make this plan. And then looking at the city's allocation in 2025, just to give you a ballpark number of the amount of money that we're looking at, and I'll stop. I see Adriana has a hand up.
Thank you, Grace, and thank you for being here. I just wanted to point out that Kara House placed a comment in the chat asking for full acronyms or state full acronyms so that those who are not familiar with the program can better understand it. That would be awesome. Thank you.
Okay, thank you. With the 2025 allocation, the city was allocated $656,000. So again, that is an annual allocation that is based on a formula. There are a few different things that go into it, but generally the city's allocation will stay roughly around this amount. And just to add some more context, like with the public services I mentioned earlier, that has a cap of 15%. So putting this into context, that is about $100,000 of this allocation. So the city can take $100,000 towards public services and case management type services, and that's it. And then the city can also take 20% of this grant for administration. So developing these plans, running the program, things like that. So after you take the admin out, you're left with about $525,000. And then the city also receives some program income. So for those of you that are not familiar with this program, if the city puts funds into something that turns out to generate revenue, that money has to come back into the program. And one example of this would be, for example, if there was a housing rehab program, I know that hasn't been funded for a couple of years, but typically with housing rehab, you will provide assistance to a household. Let's just say it's $20,000, and in order to protect that investment, a lot of times cities will put a lien on the property or essentially create a mortgage so that the house can't turn around and sell the house the next year and make a profit off of it. If they do decide to do that, a lot of times they will be required to return the funding to the program. So the city does have some program income coming in each year. I think for 2025, it was about $100,000 that gets added back into the CDBG program and is added on to that entitlement allocation that is received from HUD. Any questions on this piece before I move on? And now looking a little bit more at the process. So we're in the first stage right now. We're at the early stages of collecting data. It comes from the American Community Survey, and that is part of the census. And I mentioned census tracts and block groups earlier. So that is little, basically pockets of the population within the city, how it's broken up, and the census will provide data on those areas. So I have some maps later in the presentation, and I'll kind of point those out. So we're collecting the data and developing the needs assessment and market analysis. That should be done within the next week or so. And so after we develop this, the next step will be identifying the priority needs and goals, which is one of the things we wanted to discuss with you today. And then from there, we will develop the annual action plan. So HUD requires cities to allow for citizen participation throughout this process. And HUD has some minimum requirements, and the city is also taking some extra steps to receive feedback from the public and stakeholders. So like I said, Eric will be out next week to hold some evening community meetings and then also have some focus groups with stakeholders. And then we do have surveys posted online as well, and I have QR codes for those at the end of the presentation. But we have a community survey for residents and then a separate survey for stakeholders. They've been posted for a little while. Right now, we only have, I think, like 7 responses. So we'd really appreciate assistance getting the word out there for the survey too and sharing the survey. So we'll take the information from these meetings, the surveys, and the data to help inform and develop our needs and goals. And then once we have the final con plan drafted, that's expected to be complete in early 2026, the city will put the consolidated plan out for public comment. So that is a requirement by HUD that we release it for a 30-day review period and allow the public to make comments. So with this process, there's really opportunities for people to participate from the beginning to the very end. So after the 30-day comment period is complete and everything is finalized, the city council will approve the plan and it will get submitted to HUD. So the city has a program year start date. Cities get to select when they want to start their program year. This Flagstaff has selected July 1st. So with this timeline, working backwards, the city's con plan is due in mid-May. However, the con plan cannot be submitted until HUD has announce the allocations, and HUD cannot announce the allocations until Congress has passed a budget. So I'm sure you're all aware, we are currently in a government shutdown because the government cannot finalize a budget and approve a budget. So we are expecting this to cause some delays this year. And to be honest, the last several years, I don't think an allocation has come out on time and been announced on time for anybody to submit their plan in May. So HUD does kind of have a contingency plan. Once the federal budget is passed, HUD has 60 days to let all the grantees know what their allocation is, and HUD takes every bit of those 60 days. So after those 60 days, the city will then have another 60 days to submit the con plan and is granted an automatic extension. So just for example, with 2025, the continuing resolution for 2025 wasn't passed until mid-March, and HUD was not announcing the allocations until mid-May. So literally when the city was supposed to be able to submit their action plan last year, they were only finding out what the allocation was. So that does cause some delays, but we are going to continue with the timeline, expecting that the plan will be submitted in May so that as soon as we do have these allocations, we can finalize everything and submit the plan on time. And then with all of our citizen participation too, HUD allows us to put in some contingency language to just say, we're basing this budget off of last year's award. If it's increased or decreased, here's where we'll adjust our numbers. So we don't have to wait for those final numbers to delay our public comment period or anything. So once the plan can finally be submitted to HUD, then HUD reviews the plan and will send it up the chain to headquarters to execute the grant agreement. And so the city can't begin expending the funds until the grant agreement is executed. So even though we have July 1st program year start date, it doesn't mean that the funds are going to be available on that date. So that's another reason why we want to get the plan submitted as early as possible. I know of a few grantees that didn't have to submit until August of 2025, and they were later in the process and they didn't get their grant agreements until, well, they didn't get them at all. So they did not receive their executed grant agreements before the government shut down. And so they do not have any access to their 2025 funds. So we want to prevent that from happening with Flagstaff.
Grace, may I interrupt with a question? Has it ever happened that a city does not get the grant awarded, or is there a period of back and forth between HUD and the city to make updates or corrections or anything like that?
Yes, there is a process. Typically, the the regional HUD rep, we call them, the person that's assigned as essentially your grant manager at HUD, will be the first person to review the plan. They have a checklist and they will come back and say, can you please clarify this, correct this? The only circumstance that I'm aware of when a plan would be totally rejected is if it is not submitted by the statutory deadline, which is August 15th. So even if there are questions or things that need to be corrected, HUD gives you a chance to correct them. I don't know if you all heard, I think this was in March or April, in North Carolina after the hurricane hit there, and there was a lot of disaster recovery funding awarded from HUD. They had a plan rejected because they had language in there that did not comply with the executive orders related to DEI. And we actually got a lot of pushback from HUD this year with plans that included words that they did not think complied with the executive orders. So I think they had like an AI system that was reviewing the plans, but in all of those cases, they just sent back the plan. They said, change this language, put in this clause that you're going to agree to comply with all the executive orders, and then the plans got approved. So I don't see that being an issue as far as getting the funds awarded or a grant agreement executed.
Thank you so much.
So now I will give you some preliminary data that we've collected so far and just some background on the data. So I mentioned a couple times the data that we use is from the American Community Survey, which is part of the census. And that data lags a couple of years. So right now, the most recent data we have available is 2023. The 2024 data won't be posted until December, but we didn't want to delay the process and wait for that data to come out. So we've gone ahead and started drafting the plan with the 2023 data. And then also just note the way that they compile this data so it's a little bit more accurate is they do it over a 5-year period. So the data that we're going to look at is 2019 to 2023 data. So if something looks a little off or lower than what you think it should be, that is probably why. So in addition to just looking at the numbers themselves, we also compare them to the ACS data 10 years ago to help look at the trends and see where things are going. So first with city population highlights. As of the 2023 ACS data, the population was 76,333, and this was about a 15% increase over the last 10 years. And then comparing that to households, there are about 27,800 households, and this is a 21% increase in the last 10 years. So if we compare the population growth and the household growth, we're seeing households increase at a higher rate than the population. So that tells us that there's probably an increase in smaller household sizes, and we're seeing more individuals, maybe elderly or young single adults that are moving into the city. And I did see a hand up, Tyler, I think.
Yeah, I had a question about the median income increase. Is your read on that data that the people moving to Flagstaff have much higher incomes than the existing residents? Or is there some pattern where wealthier individuals are moving into Flagstaff as lower income residents are being forced out? Because that median income increase is just very high.
Yes,
Stands
and
out to me.
there is a note. So this is just in nominal dollars and doesn't account for inflation over the last 10 years. So these are just the raw median income increasing. And this is pretty standard for what we see in most cities over the last 10 years. But yeah, that very well could be the case that there are higher income residents moving in. I know out west, especially, a lot of people, especially since COVID, have been moving out of California and more expensive cities and moving into some of these smaller towns and increasing the median income and also your housing prices.
Great, thank you. We have another question from Commissioner Zoria. I'm sorry, I'm going to mispronounce that.
Oh,
Could
no,
you
don't
pronounce that?
worry. Thank you. It's Zoroya. You were very, very close, so don't worry. Just to kind of go off Commissioner Denham's question, I mean, I see your data source here, and maybe I just don't know what that is, and that's fine. But I mean, could that include income from people who are not here all year round, but own a home? Or
I think for the most part, the income data is based on the people that are permanent year-round residents.
okay.
But also note too, this is the median income, which is a little bit different than the average income. And I'm not sure what the average income is because with the HUD programs, we always base it off the median, but it's not the mean or the average, it's the center number. So there's not like if it were to be the average, there's not higher incomes that are skewing the average higher, if that makes sense.
Yeah, that's why I thought that was so interesting. Medians are typically resistant to large swings in data sets.
Yeah, and we can look at this closer and follow up too. I can dig into the data a little bit more, but without accounting for the inflation, I think that is a big piece of it. Any other questions on this slide before I move on?
We have a comment from Commissioner McLaughlin.
I think another impact on median income is our increase on minimum wage. So you're seeing a lot of folks at that lower end moving up. Over the last 4 or 5 years, we've seen pretty significant and ongoing increases. And so I would think that that would have a larger impact on the overall median going up too. So that could be a factor in impacting this.
Yep, that's a very good point. Any other questions before we move on?
I don't see any in the chat, so thank
Okay,
you, Grace.
sorry, I can't see the chat since I'm sharing my screen, so just stop me.
I'll stop you when it makes sense to. Thank you.
Thank you. Next, we have some data on the poverty rate. So in this map, just to give you context about some of the data that I've been talking about, you can see how different areas are shaded different colors, but the way those shapes are formed is based on the census and based on the population size. So that's why some are smaller than others. And then within the census tract, there's also block groups, which is even a smaller population group. But for the most part, we look at census tracts for this report. But with the poverty trends, so in this table, we have the trend for the city over the last 10 years and compared to the state. So in 2013, the poverty rate was 24.6%, and that has dropped to 19% in 10 years. And if you compare that to the state, the percentage drop is about the same, but the city does have a little bit of a higher poverty rate than the state as a whole. So that's what this map on the right-hand side is showing. The dark blue in that downtown, southern downtown area is the highest poverty rate. And then as the colors get lighter, that means the poverty rate is lower and lower. And then also to just add some context to these eligible thresholds for CDBG, the low to moderate income LMI, we say, threshold for CDBG is based off of that area and median income. So anybody or a household with income 80% of the area median income or less could qualify for CDBG programs. So putting this into context again, a household of one person that's earning $61,000 could qualify for CDBG programming and is considered to be in that low to moderate income range. So this kind of helps put it into perspective. Like we're not just talking about people that are on fixed incomes or Social Security, somebody that is working full-time, earning a decent amount of $61,000 is still considered low income for CDBG. And now we will look at a little bit of the housing statistics. So again, with these numbers, we're looking at the median. So the median home value increased by 89%. So it went up from 266,000 to 503,000. And the contract rent went up 53%, so it went up from 925 in 2013 to 1,415 in 2023. And then we also have that median income increase here again, just to compare. Your home values and rents are increasing at a faster rate than income, so most likely residents are struggling to keep up with the housing cost increases. And then we also have a table here for the age of housing. So the blue bars are owner occupied and the orange is renter occupied. We have it broken down by 2000 or later, so that's your newest housing, a little bit more renter occupied, housing developed since 2000. And again, this is since 2023. So there could have been some major developments in the last 2 years that are not incorporated into this table. And then 1980 to 1999, again, increase in renter occupied housing, but the owner occupied is kind of flat across the board. And then our housing built before 1950 is pretty low, but we do have some concerns with housing that was built in this 1950 to 1979 era. There's quite a bit of housing here, and the concern here is housing built prior to 1978 could contain lead-based paint. So with this older housing, we're concerned about some lead-based paint hazards, especially if there are children in a household. And then the map over here is another breakdown of census tract information and different home values. So the most expensive home values are the dark blue, and then the lower home values are the lighter blue. I think the most expensive track I want to say was this this track over here. I'm sorry, I didn't mean to click that and change the page. Over by the airport. I think that that tract was, I want to say it was like $725,000, and then the lowest one was up north over here for about $300,000 for the median value.
Grace, before you move on, could I ask a question?
Mm-hmm.
For the concerns about lead-based paint, is that something that CDBG grant monies could be used to remediate?
Yeah, so there are actually some requirements in the CDBG regulations and with HUD that if you are doing rehab to a house that was built prior to that year, 1978, there are some requirements for lead remediation, and there are some specific CDBG programs that do focus specifically on addressing lead paint.
Okay, thank you.
And moving on now to housing cost burden. So this is the main statistic that we look at when we're discussing housing affordability. So housing is considered to be affordable for somebody if it is 30% or less of their income. So if their housing costs are 30% or less of their income, that housing is considered to be affordable. If they're paying over 30%, they're considered to be cost burden. So this slide, we're looking at the homeowner housing cost burden. So the total cost burden is about 20%, and that's split evenly between cost burden. They're spending between 30 and 50% of their income, and then there's another 10% spending over 50% of their income on housing costs. So just a few impacts of this, obviously the financial strain and the reduced ability to pay for other essentials such as food, healthcare, transportation, risk of foreclosure, and then reduced savings and investments. And we also see with financial strain and the reduced savings. We also see limited ability to keep up with maintenance, and that is where we kind of run into issues with deferred maintenance, and that's why there are so many housing rehab programs across the country to address this issue. So again, with this map, the dark blue is the higher percentages of homeowners who are cost burden, and the lighter shades are lower percentages of households that are cost burden for homeowners. And then looking at rental, oh, I'll pause.
Yeah, I think you're going to answer the question I was going to have with the rental, because I've seen much higher numbers, but I think it's total homeowner and renter cost burdens. So I think you're going to answer my question in a minute.
Yes, I think that is correct. So over half of the renters are cost burden. So in total, 56% are spending more than 30% of their income. Of that 56, 25% is spending between 30 and 50, and then 31% is severely cost burden. So this is definitely an issue that residents are facing throughout the city. Similar financial impacts with the financial strain, risk of eviction, and then a big one is the inability to save for home ownership. So sometimes renters, they just get trapped in a renting situation because they never have enough money to save for a down payment to invest in a home and begin building equity. And so this map, same thing again, the lower colors are lower percentages of households that are experiencing cost burdens in that area, and then the dark blue are the higher cost burdens. Any follow-up questions to this slide?
I have one, but I want to wait for the other commissioners to weigh in if they have any. This is I don't see any, so I'm going to ask my question. My question is, if you bounce between the various maps you have here of the home values, the homeowner cost burden, and the renter cost burden, there's some interesting disparities between, like the home value and who is cost burdened in the areas and stuff like that. Do you have any deeper analyses of those kinds of relationships that you could share with us? Not necessarily asking you to do that analysis on the spot. I'm just wondering if you've done a deeper analysis.
We definitely will have that in the market analysis. So we have some other maps, but you're absolutely correct. Like looking at these and even going back to like the poverty, this shows that most of the poverty is concentrated right in this central area. And that area had insufficient data for median home values. I'm not sure why. Sometimes there's weird things in the data, and it might be because I'm actually not sure. It wouldn't be like renter versus homeowner. But as you look through here, yeah, a lot of these see that there's a little bit of fluctuation, but for the most part, like the dark areas are the same between homeowner and rental. But we'll definitely do a deeper analysis in the market analysis of the con plan.
Great, thank you. Commissioner Denham, you have your hand raised?
Yeah, I have some speculation on why there's insufficient data for that area, because I've also looked at ACS data and tried to combine it with Coconino County data, more fine-grained data. The majority of the housing in that area is concentrated to a relatively small handful of condo and apartment buildings. And I believe that ACS, if it's a small enough sample, they just categorically exclude summary statistics.
Okay. Yeah, that's great context and very helpful for us. And yes, that is true. That's kind of how they determine there's insufficient data. And that's also why we look at the 5-year data from 2019 to 2023. It's expected to be a more accurate and comprehensive sample than just 1 year.
Great. I don't see any other hands or Qs or Cs in the chat. So thank you, Grace. Please continue.
Great. Okay, so that wraps it up for the data snapshot and some of the background information. Happy to answer any other questions about the con plan process, eligible CDBG uses, anything like that. Also happy to follow up with any immediate data requests. Like I said, we do hope to have the needs assessment and market analysis drafted and final for staff review within the next week or so. But also just wanted to open up the floor for additional thoughts and input as we work on the next steps in developing the strategic plan. So I have a couple of kind of guiding questions that I'll go through to get your mind thinking and we can discuss. And then I'll also have survey QR codes. So if you want to get your thoughts together or, want to come back to this later, there's also an opportunity to provide feedback through the survey. So first, just how do you prioritize the various community needs that are eligible? So between affordable housing, economic development, supportive services, public facilities, and home repairs, what is the highest need and best use of the limited amount of funding? And then also specifically within housing, what are the biggest housing issues that you see in the city? Is it lack of available units, location, mismatch of housing type and size? So with that, for example, a lot of times we see very limited number of rentals or apartments that can serve or house larger family types. So a lot of times we see, not very many 3-bedroom apartments and mismatch there. And then also just with rental costs and cost of repairs, what are the biggest issues here? And I will go ahead and share this stakeholder survey QR code here so you can have it, and I will open up the floor.
Thank you so much, Grace. This was fantastic. We have a cue from Commissioner McLaughlin.
Yeah, hi, thank you so much. I'm not sure if this is a question for you, Grace, or for city staff, but I'm wondering about identifying target neighborhoods, as I believe that's part of the consolidated plan process. And if that's something that you guys recommend as consultants, or if it's just a matter of if it hits this metric, and this metric, we've got them. Like, is there any ability to add target neighborhoods in this consolidated plan?
Yes, that is one piece of it. And I know there were a few in the last con plan. I think Sunnyside, there were a few others. I don't know them off the top of my head. Christine, do you?
Yes. Yeah, it's Sunnyside, Southside, La Plaza Vieja, and Brandon Homes. And I kind of started looking at the data. We haven't really had a chance to meet with them to talk about this yet, Commissioner McLaughlin, but we are excited to. I do think we might be able to add a neighborhood or two. In the past, we've always done it based on a concentration of low income households and minority households in order to kind of key it in a little bit. And so there'll be conversations about whether or not that's something we want to continue to kind of pinpoint or if we want to broaden our reach and our definition a bit. Sorry to interrupt, Grace.
No, thank you for answering with those neighborhoods. I didn't know them off the top of my head. But yes, can add more, adjust as needed. And there's not necessarily a requirement to do targeted areas either. I know sometimes there will be a lot of back and forth. There's a lot of focus areas within the city. And sometimes cities don't really land on specific target areas in the con plan and kind of just do a general citywide target so that there's some more flexibility and you're not really like locking yourself into anything specific and having to specifically put this amount of funds towards this neighborhood. But either way works.
So then is there, so it sounded like it had to do with the percentage of poverty in a particular, is it block group or census tract 1? And then it was also my areas of minority concentration. That's how we got to the 4 we have now.
Yes, that's how we've done it in the past was we kind of overlapped those two metrics. the more I've learned about CDBG, you can kind of, and correct me if I'm wrong, Grace, you can kind of define an area benefit project. You can define the area as long as you have reasoning for why you are defining it that way and how you are measuring the households that are low and moderate income to be at least 50% of the households in that area as low and moderate income. Does that sound right, Grace?
Yeah, and with defining those target areas, typically you'll include census tracts and block groups, but there's not like a specific like formula or prescribed method for determining your target areas.
So then can I put out there that this is an area I would really like the city to consider expanding? And not because a certain amount of dollars have to go here. I recognize we've done like priority points or something like that in the past, which I think is a great way of addressing it. My follow-up question though is if a neighborhood is identified as a target neighborhood in the consolidated plan, would that count toward the qualified allocation plan for LIHTC as a reinvestment area to get points for LIHTC developments if they are in any of these designated areas? And maybe that's a question for Jen, but I can see this being a tool to help developers get extra points in the QAP.
Yeah, if it can, that would be amazing, but that would definitely be a question for Jen.
I'm going to start and then I'll let Jen jump in. I don't believe so. So Jen's done some research on this, and for an area to be designated as a revitalization area, it actually needs a plan of its own. So it cannot just be as simple as just a target neighborhood. But Jen, feel free to hop on and correct me.
Yeah, it's true. The community revitalization plan points are very, I mean, they're broad relatively, but they are specific to a city adopted plan where city dollars have been set aside to reinvest like in infrastructure toward more housing. It is an interesting thought though. I know the QAP already includes points for like difficult development areas, DDAs, and if a project is going to be located in a qualified census tract. So that might kind of get at what you were suggesting, Devonna.
I don't think it does, because this is 5 extra points. And so, and the QAP Moses is the qualified allocation plan, which is how points get awarded for low-income housing tax credit projects in our state. And so perhaps this is an area of clarification when we do feedback to the state for the qualified allocation plan to say, could a consolidated plan target neighborhood count towards getting these reinvestment area points? Because it isn't just DDAs, difficult to develop areas, or poverty areas. It has to be a plan adopted by the city that says we care about investment in these neighborhoods, which I think this is exactly meeting that criteria because it's identifying census tract or block groups and saying we are trying to incentivize development to target low-income households in these particular areas. Like that does exactly what a revitalization plan would do without us having to do a special revitalization plan for however many neighborhoods.
I think it'd be
and I don't know that we have the answer, but if we can tie these together, if we can expand our target neighborhoods so that more of the city is under those, so they could get points, this could be a way to attract LIHTC development that could score competitively at the state to get additional affordable housing investment in Flagstaff. It's just a thought.
Agreed. That's a good idea, Devonna. We can work on some language and a comment letter to ADO, which is due soon. So,
it's November 7th, and yeah, I'm happy to add that language to mine too. So if we can work together, that'd be awesome. And I'm sorry to take it sideways, but I just saw that as an opportunity.
Thank you.
Great conversation. Thank you. Are there any other questions or comments for Grace? All right, seeing no hands raised and no Q's or C's in the chat, I'm going to say thank you very much, Grace. That was a wonderful presentation and very informative. And we will be moving on to an informational presentation from Catholic Charities by Sarah Rendon from Catholic Charities.
Good afternoon, and everyone. Sarah Rendon, another Sarah in the room. I do have a short presentation on Catholic Charities housing programs. I'm going to try and present this in Teams. Sorry, give me just a moment to try and share my screen. Sarah, if you have a really hard time, I did last month. Let me know and I can share my screen. I've got your presentation pulled up. Thank you so much. Are you able to see it? I don't think it's in presenter mode. It's not.
It's not.
Does anybody able to help me?
There's a little icon down at the very bottom next to the volume or the zoom scroll on the left of it. Looks like a brain stopped working. A screen up a little bit
The
to the right.
projector? So
Yeah,
sorry.
the projector screen over to the right. Just a touch. One more. There you go. Oh,
Get
you were
guys
there.
out of here. Right here. Sorry about that.
No worries. There we go.
Perfect. Thank you so much for your help with that. Everybody can see my screen now.
I can.
Well, good afternoon, everyone. Thank you so much for having me. My name is Sarah Rendon, and I'm with Catholic Charities Housing Programs. I know most folks here know that Catholic Charities does have a lot of robust housing programs here in Northern Arizona, but our programs ebb and flow based on the needs of the communities in which we serve, industry best practices, and of course, funding availabilities. So I'm here today to talk a little bit about kind of the latest and greatest that we have going on here in Northern Arizona housing. I first just wanted to share Catholic Charities' mission of helping our communities most vulnerable with solutions that permanently improve lives. I am here today to talk about housing specifically, but our housing programs operate alongside a robust homeless services team, which includes veterans programs here in Yavapai, Coconino, and Mojave counties, as well as our Path Street outreach teams. So our veterans programs provide housing for veterans, and our Path Street outreach programs do that really boots on the ground outreach out in the community, serving our communities most vulnerable and really bringing them into the door into services and connecting them ultimately with housing. Housing in any of our communities, of course, is coordinated entry. Coordinated entry really is the initial assessment process that our communities use to address homelessness. It looks like an appointment with individuals and families to determine eligibility, priority, and really kind of what the best fit would be for those folks given the services that we and resources we have available in our communities. We complete coordinated entries via phone by calling our front office and scheduling an appointment. We also have walk-in hours here in Flagstaff, Tuesdays from 8 to 4 and Fridays from 8 to 12. It's on a first come, first serve basis. So if individuals or families experiencing homelessness need to complete a coordinated entry, they can either contact us or come in for some of our walk-in hours. We also do walk-in hours at our office in Page, Arizona from Monday through Thursday from 9 a.m. to 3 p.m. Here in Coconino County, our partner Flagstaff Shelter Services also completes coordinated entries as well, and that can be scheduled by calling that phone number listed right there. And again, that really is the first step towards housing here in our communities. We meet together as a community weekly at Case Conferencing on Thursdays, where all the different housing providers come together to discuss, again, resources, priorities, and best fits for the communities most vulnerable. Sorry, does anybody else hear that?
I don't hear anything. I can see the slides though.
Okay, sorry, there was some sort of translation service that was coming through my computer, so it sounded a little funky. This is just an overview of housing. Like I said, here in Northern Arizona, we cover all 5 counties, so Coconino, Mojave, Yavapai, and we have recently expanded services to Navajo and Apache County, which is very exciting. There is a great need for housing services in that area, and it's been really amazing to be able to help address some of that need. Some of the services that we provide, some of our more traditional services, of course, are permanent supportive housing. We work alongside community partners. I saw Corey here today to serve our community's most vulnerable. Permanent supportive housing is for individuals and families that are chronically homeless, meaning they have the length of time, a year or more in literal homelessness, as well as a disability that impacts their ability to maintain or obtain housing. We operate about 50 permanent supportive housing units here in Coconino County and 125 across Northern Arizona. Again, those are for folks that have been experiencing homelessness for a long time. So the supportive services that we provide are essential. We do very intensive case management. We work closely with behavioral health and any other outside community partners that in order to help folks remain stably housed. Folks can remain in permanent housing as long as they are following the rules of the housing agreement and as long as they need. The next program we have is rapid rehousing, and that is for individuals and families that are literally homeless. So they don't need the length of time necessarily and the disability diagnosis that is required for permanent supportive housing. It is for folks that are able to self-resolve a little bit more easily with some assistance provided from us. We provide temporary rental assistance and moving costs. Services can be up to 6 months. While they are in services with us, we work closely, again, with behavioral health, but we do a lot of budgeting, financial planning, connection to resources, pretty intensive case management for those 6 months, and we gradually reduce the amount of assistance we provide so that hopefully at the end of that term, they're able to take over their own lease and remain in housing. Our community reentry programs are something that I find very special. We operate 7 community reentry homes across Northern Arizona, 4 in Coconino County itself. We have 3 here in Flagstaff and 1 in Page. What's really special about our community reentry homes is that we do not prescribe to any particular modality of recovery. It really is safe, stable housing for individuals exiting the justice system. It is a sober living environment, but we do not exit if somebody relapses. We do allow folks to take any medications that are prescribed to them. It really just is safe, stable housing so individuals can work on all the other things that they need to work on, whether or not it's graduating parole and probation, working on their sobriety, reunifying with family. We see some really great successes from people's worst day to, moving into other programs that we have to offer after community reentry. We also have staff 5 days a week at Pathways, which is a partnership with Coconino County here at the jail. We see individuals exiting the jail, and as soon as they exit, we are able to complete a coordinated entry right there at the jail with them. We work to make, a lot of times, I think 90% of the folks that we house in our community reentry houses right now are coming out of Pathways. So that's a really amazing partnership. It means that they don't have to be on the street before they get housed. We're able to really just move them straight from Pathways into one of our community reentry homes. If that's not the case and folks don't get housed right away out of Pathways, we do allow folks to come back in and hook them up with other resources. We'll do applications to various other housing programs in town, Sharon Manor, etc. But that's been a really amazing partnership for us. One slide that I think I don't have on here, but it is also one of our communal programs, is our family shelter. We operate 2 family shelters, one in Bullhead City and one here in Flagstaff. It is for up to 3 families at a time and 90 days. Each family has their own unit. And again, because of the quick length of time, 90 days, it is very intensive case management while we work to get folks hooked up to, again, lots of community resources. We see lots of families that come through this program whose kiddos haven't been in school for a long time because they don't have a permanent place or an address to use. So we work closely with McKinney-Vento and, of course, all of our other community partners to get them very hooked up to resources while they're in family shelter, because 90 days goes really fast. So a lot of times folks will come in and feel like they can kind of let their guard down because they've been in a situation that's obviously very intense, and they come in and feel they can relax, which is amazing, and we definitely want that, but at the same time there's a lot to work on. Again, same with community reentry. We offer permanent housing solutions if folks qualify once they exit our family shelter. So we love to have folks transition from one program to more permanent housing. Garcia Family Foundation is one of our newer programs that we have. This is a one-time funding source, really aimed to address families on the community's by name list. So we are looking to help people through diversion, meaning rather than getting folks, into the system, if there's something that we can do to help them access housing again before they enter the system, we can provide that. If it's a bus ticket to a grandma's house in another state that offers permanent housing there, that is something we can provide. Again, just diverting them out of the system to begin with. If they have family, friends, we have a conversation with them. Any way we can transition them that way, that is what diversion is. Rapid resolution is very similar to rapid rehousing. However, it's more of a light touch. So with this money, when we're assessing folks, we're really looking at families that are able to resolve after a little bit of assistance. So it's not going to be that, 6 months to a couple of years of case management. Again, it is a little bit of a follow-up, but they should be, after a little bit of funding, able to kind of self-resolve. And homeless prevention, of course, or eviction prevention, that is for individuals that have that are imminently looking at exiting into homelessness, and with a one-time funding source, we'll be able to prevent that. And again, this is to address families in our communities in hopes that these methods of assistance will reduce family names on the by name list. Next, we have our H2O program. This is housing and health opportunities. This program is funded by Access and administered through Solari. We work very closely with our PATH outreach teams for this program. This again is for individuals in the community that are extremely vulnerable, that have SMI determinations, justice involvement, are experiencing homelessness, and really need that support to be able to even engage with the system to begin with. So again, out there in the communities, working alongside our PATH teams, trying to bring folks in and working very closely with behavioral health. Most of these folks are enrolled with behavioral health, and we have been able to build some or enhance our partnerships with behavioral health through this program. Once folks move from outreach and education into pre-tenancy and tenancy support, that looks mostly like housing navigation. So again, helping folks get hooked up with coordinated entry, all the different resources and applications that our communities have to offer. We're able to provide a little bit more hands-on support through this program, which is amazing, as far as things like filling out applications, transporting clients to potential housing opportunities, things like that. And of course, if Catholic Charities has programs or other programs within the community that folks can move on to, we have housed some folks through Oak Wash and in Cottonwood through our H2O programs, which has been amazing, as well as our own Catholic Charities programs, such as permanent supportive housing and rapid rehousing. And I think the last the last program we have here in Coconino County that I wanted to talk about, and for some reason I don't have a slide, but is our hotel to housing conversion Pinion Point in Page, Arizona. We currently, that is a, like I said, that is a 20-unit hotel to housing conversion. It is transitional housing, so 2 years of housing, up to 2 years for individuals and families. We are staffed on site, and we do provide really intensive case management and housing navigation for that program as well, because the intention is, of course, that after the 2 years, families will move on to more permanent solutions. But that has been also a great need in the Page area that we've been proud to address there. And I think that is it.
Thank you so much, Sarah. Do we have any questions or comments from commissioners? I don't see any hands raised or Qs or Cs in the, there we go. We got a C from Sandy. Sandy, go ahead, please.
I just want to say, first of all, thank you, Sarah. I work at Catholic Church, y'all know that, but it is just such a huge amount of programs, and I know there's no way to digest that all very quickly. But just to kind of put that out there, the volume of things that we have. So Sarah, great job. I really appreciate that. I did want to point out one of the things that's really on the hot seat right now, as you saw in several of Sarah's slides, we've always run programs with a housing first model. Housing first is threatened right now. So however you feel about that, I will just say that's a topic of conversation that we may, with our new contracts that are just finally starting to roll out, that is no longer a priority in the contracts. And so we haven't made the changes on the slides yet, but that may be coming. There's a lot rolling out. There's also a big threat right now to permanent supportive housing as a whole. There's a lot of talk that may convert to transitional housing. Just so that you know, the continuums of care, which is known as COC, you'll hear us say COC, around the country, a lot of them, and Arizona in particular, has about 80% of the COC funds geared at permanent supportive housing. We're hearing rumors that maximum may be 30% in future years, which will definitely change the landscape, and there will be a potential risk to individuals and families that are in permanent supportive housing to lose housing. So we'll come back to you when that comes. I think this is a good group for some advocacy around that. So, but thank you, Sarah. I think that was great.
Thank you, Commissioner Flores. We have a comment from Councilmember House, and I'm sorry for just calling on the commissioners earlier. Of course, the council member is welcome to comment or question.
No apologies necessary, Chair Milazzo. I completely appreciate that. I just wanted to note, first of all, thank you, Sandy, or Commissioner Flores, apologies, for what you shared about the shifting landscape when it comes to housing first and several other programs that are kind of being renegotiated or re-looked at in the current landscape. It's presenting a lot of challenges. And the other one that I'd like to call out is, Sarah, I really appreciated your presentation on the work that Catholic Charities does in terms of reentry. There's a lot of connectivity between justice impacted individuals and people with mental and behavioral health concerns, re-entering society from institutionalization or hospitalization or experiences in prisons or jails. And I would just like to emphasize how important those reentry services and supports are. I recently had the opportunity to experience a reentry simulation, and it was one of the most frustrating experiences of my life, just seeing what someone who is re-entering the society and their community after justice impact or experiencing behavioral health crises has to go through to try and navigate systems. That would be an exercise that I might recommend for the Housing Commission. If you have a retreat or an opportunity to engage in that sort of exercise in person, it is very telling and gives you a much different perspective on those experiences that could help shape some of the recommendations and conversations that you have as you're leading some of the housing conversation for our community. So just wanted to call that forward, and thank you again, Sarah, for the presentation.
Thank you, Councilmember House. I really appreciate that. Would you be willing to share with perhaps Adriana, who could share with us the information on how to sign up for that, or if that's something that needs to be better coordinated, or whatever the particulars are?
Absolutely. I can research who it was that did our simulation and share that information with the housing team.
Great, thank you so much. Do we have any other questions or comments for Sarah? Okay, thank you again, Sarah. That was a fantastic presentation. We will move on to agenda item number 8. 8A is update from Housing Authority Liaison. That would be myself. Our Housing Authority Board did not meet this month because of a last minute recognized error in the agenda that made it impossible to meet open meeting laws. There were no action items that were urgent, so we simply postponed the meeting to next month. Item B is update from housing commissioners and other informational items. So at this time, I'm going to open it up to the housing commissioners. If you have any updates you would like to share with the commission. Okay, no Qs, no Cs, no hands raised. So I'm going to move on to 8C and open it up to updates from the housing staff.
Hi, everyone. I'll start. So I'm extremely excited to announce that on Tuesday night at City Council read for the first time an ordinance that will make the housing section a housing division. And so with that change, we will be renamed from housing section to housing division, and we will report to the city manager's office instead of how in the past we have reported through community development. That changed when Dan Folk left. We do now report to Joanne Keene. However, officially, we will now be reporting to the city manager's office, which is very exciting, and we wanted to share that with you. So thank you.
That's great. Thank you, Justina. Any others? Adriana.
Thank you, Chair Milazzo. I am excited to report also that Tuesday was a very, very, very busy housing related council meeting. They were able to review our proposed changes to the Community Home Buyer Assistance Program and the contract with Housing Solutions of Northern Arizona. They approved to have the contract increase from $80,000 to $500,000 for administrative fees to Housing Solutions over the next 7 years. And the permanent affordability pilot, which is going to allow first-time home buyers in our community to receive deeper assistance up to 30% of a qualified home's purchase price in exchange for securing permanent affordability. So that's been approved. And then lastly, we got a date for a special election for the Flagstaff Regional Land Use Plan, otherwise known as the Regional Plan 2045. The special mail-in election is going to be on May 19, 2026. If it passes by the voters, the regional plan adoption will actually help advance 4 of the strategies from the 10-year housing plan. And that's all I have. Thank you.
Thank you, Adriana. Could I ask a question about the regional plan? What happens if it is not passed by the voters?
That's a great question. I think that's a little bit outside of my area of expertise. I see Jen unmuted herself if she has any input since she was on the.
Sure. Yeah, that is a great question. I think the best person to answer that question would be Sarah Dector, the comprehensive planning manager. I do believe it would mean substantive changes to the plan, so that it would have to be re-reviewed by council and put back on a ballot to try to get that adopted by the community.
Okay, thank you. And Christine, I see your hand is up.
Thank you so much, Chair Milazzo. I just wanted to kind of give a quick narrative update about the upcoming public participation we have for the consolidated plan, but it's a lot of details, so I'm mostly going to send it out in an email or ask Adriana to send it out in an email to you all. So next week, our consultants will be here to help us undertake a couple of public meetings and focus groups. We're going to have 2 focus groups that are really invite only. However, you are welcome to invite anybody you think might be able to bring some good feedback to us. And so we're going to have one that is specifically about housing and homelessness. That's on Wednesday at 10 a.m. And then on Thursday at 10 a.m., we're going to have another one that focuses in more on public services and economic development. So public services would be more like childcare, mental health services, whereas homelessness would be more specifically shelters. A public service can also help homeless individuals, though. So we kind of decided to split it down the line there. We're looking for input about what folks see as priorities for our community. We're also going to have a community meeting. So this one is open to the broader public, especially folks that are low and moderate income or live in low and moderate income neighborhoods. It's going to be at the Market of Dreams on Wednesday, the 29th from 4 to 6 p.m. And we will be kind of giving an overview of CDBG, but really hoping to get resident input on what they see as the needs in our community that our CDBG dollars and perhaps someday other HUD resources might be able to address. So that will be all next week. We are really excited to have our consultants here and see some of the feedback we get back. There will be other opportunities over the next couple of months to participate. So if you can't make it, we totally understand. And then as Grace said, we do have those surveys. And so I'll send those out. We have a stakeholder survey, which would be for you and your colleagues. And then we have a resident survey. So if you want to send that out to the folks you work with or you know, friends and family, that would be great too. So you'll see that email either today or tomorrow. Thanks so much.
Thank you so much. And I think Aiden is next.
Thank you, Chair Milazzo. We'll start with a Housing Commission, or sorry, Housing America Month update. If you haven't seen our social media accounts yet, we've been sharing affordability spotlights throughout the month, which is October Housing America Month, to highlight affordable housing developments across the community and the city's role for making those possible. We've been taking photos, gathering project details, and writing accessible captions to help raise awareness and push back on some of like common misconceptions about affordable housing. And since there are so many developments, the post will continue into November, so stay tuned for those. The photos of these developments will be then added to the website on the affordable rentals page and the GIS tab. And speaking of the website, we've redone the homebuyer education, homebuyer assistance, CHAP, FAP, and EAH pages to make sure the website information is up to date and easy for future homebuyers to understand. The chat page will be getting another round of updates to include the new permanent affordability element approved on Tuesday, and we'll keep expanding and refining the pages in the coming months where we see needed. Thank you.
Great, thank you so much, Aiden. Do we have any other staff members with updates? I don't see any hands. Go ahead, Adriana.
Thank you, Chair Milazzo. I, just as a follow-up to Aiden's comment, I wanted to encourage housing commissioners to please follow us on social media. We post a lot of stuff. Aiden has been phenomenal at this Housing America month and the postings. There's been a lot of affordable units that have been posted, current pictures that he took with an actual professional camera, and it's just been truly amazing to see what Aiden has been able to do. I will post in the chat real quick the exact accounts to follow, but basically if you Google City of Flagstaff housing, you should be able to find it. And I've also got clickable links. Actually, I lied, I don't have clickable links in my email, but I will add those so that you can easily follow us. The other thing I wanted to publicly congratulate you, Chair Milazzo, for your first meeting as chair. You had been hiding from us because you were just a natural. It has been such a smooth meeting, and I'm just so grateful that you were able to throw your name in the hat. I know that you did it because it was awkwardly quiet, but I am so grateful that I get to work with you in this concept. And while I still have the floor, I was able to reach out to Sarah Dector in the meantime, and she was able to confirm that if the regional plan is not adopted, then we would continue to use the 2014 regional plan. She said we'd then ask for council and the Board of Supervisors what they would like to do. And then there are steps that we would have to take for a redo. Probably, let's see. Yeah, I think that's just about it for me for real this time. Thank you.
Great, thank you so much, Adriana. What Adriana hasn't told anybody except past chairs is that there's a whole agenda that's sent to me separately that tells me exactly what to do and when. So the reason it went smoothly is because I read from the teleprompter.
Thanks for the
All right,
kudos, Chair Milazzo.
I believe we are ready to adjourn. I'm going to give people one more moment to raise their hand or put it in the chat. All right, seeing nothing, I will call this meeting adjourned at 2:43 p.m. Thanks, everybody.